Ram here with Oasis Family Medicine, and I'd love to share a little bit more about our regenerative injection therapies. I kind of think of it in a sequence. So first would be prolozone, and this can often take the place of what a traditional doctor would use for steroids, a steroid injection. Anytime they would use a steroid injection, think, hey, maybe a prolozone injection might be a good idea. And a prolozone injection involves a mix of vitamins, minerals, herbs, homeopathic injection mix as well, depending on what exactly is going on. One needle into one area of your body, and then we take that syringe off and then apply some ozone. Now, ozone is actually, when you see a syringe of ozone, it's actually about 97–99% oxygen, and only 1 to 3% of that is ozone. Oxygen is O2, ozone is O3, and so it's kind of supercharged oxygen, and it goes into that tissue. Again, only one needle, 2 syringes, but 1 needle. Typically pretty painless because we use a little bit of cooling spray before the needle injection. But when that mix, when that prolozone mix hits that tissue, whether we're talking about a joint or a soft tissue area like a muscle or a ligament that needs healing, it just calms down the inflammation, which decreases pain, and then the additional nutrients that we're putting into really creates this optimal environment for healing. And sometimes one prolozone injection is all that's needed, sometimes a short series of 2, 3. Occasionally it's, hey, somebody comes in for, if they have chronic really bad knee arthritis, maybe it's once every couple months. That's their thing. They do it. It's quick, easy, in and out. It's relatively inexpensive, same cost as a regular office visit. And so that's typically where we start off. And then we can move on to something that we call the BioShot at Oasis. And BioShot is really a category where we have this mix of options that we can use. One of those options is PRP, which is platelet-rich plasma. That's where you would come in, have your blood drawn, spun down, it goes through a couple spin downs, and then we pull off the platelet-rich plasma, the small amount, where most of the growth factor, where most of your own growth factors are, and then we can inject that into an area, and we can mix it with a prolozone style of injection as well to upgrade the therapy, the PRP therapy. But again, using your own growth factors to really bring about healing. And again, that can be used in certain joint situations or certain soft tissue situations. Within the BioShot category, we have the PRP, and then we would go down to a cell-free cytokine therapy, otherwise known as exosome therapy. And exosomes, what companies are doing now is taking young stem cells, culture expanding them, and each stem cell has a bunch of little vesicles in it. And those vesicles are like pockets full of, again, healing growth factors that modulate the immune system, bring down inflammation when it shouldn't be there, upregulate growth when it should be there. And so these companies are literally spinning those vesicles out. So it's not a stem cell therapy, but it's all the healing juices is how you can think of it, is what exosomes are, what cell-free cytokine therapy is. And so again, with this type of therapy, it's beautiful because it can be injected into joints or soft tissues, but it can also be applied intranasally often for like a neurocognitive deficit, perhaps, or it can be injected into the cerebrospinal fluid via a lumbar puncture. That's a relatively aggressive procedure, but it can be done for something along the lines of neurocognitive deficit as well, like Alzheimer's, dementia, Parkinson's, ALS, those sort of conditions. And then another option is the amniotic matrix or placental matrix or Wharton's jelly matrix, which is really from the actual umbilical cord. And so those three kind of options all come from young, really the placental, amniotic, and umbilical parts of the body from a planned C-section. So healthy term babies done via planned C-section. They've already been screened for all of the known major communicable diseases with the mother's consent. And so the idea is to take these young growth factors, young stem cell products, and use those to create a healing environment for older people. And this is because as we age, the number of stem cells that we have in our body decreases, but also the quality of whatever is still there also decreases. And so to be able to take this young, vibrant growth factors, cytokines, and stem cells and put it into our body is just an exquisite possible therapy. And I have not found a silver bullet in medicine. There's no magic therapy, but I would say that this is as close as I've seen in my, nine or almost actually more than a decade of medical experience. And so it's just an amazing option. And so we have Prolozone, BioShot, again, PRP, exosomes or cell-free cytokine therapy, and then those other amniotic, placental, umbilical cord products, right? And the coolest part is that the price has come down. It's just dropped dramatically. A few years ago at Oasis, a therapy for a bad knee arthritis, we'll say, would cost somewhere in the $4,000 to $6,000 range, somewhere around there. And now it's approximately $1,500, and maybe even cheaper because more and more insurances are jumping on the bandwagon of actually covering the product for the most part, including Medicare. So it's really neat because we're actually able to offer this amazing potential regenerative therapy to more and more people at a more affordable price. So very excited to be able to offer that to anyone who it applies to. Thank you.